Thank you. Right, just to explain, we've got a bit of a double act going on this afternoon, looking at maternity from two different aspects. Janet, I'm going to deal with just the principles of autonomy, mental capacity, treatment decisions for incapacitated patients in the context of maternity, and cases that have come before the Court of Protection, which is my area. And then I will hand over to Janet to talk about consent in terms of maternity, again, where we are now, and look at some claims involving clinical negligence claims involving maternity cases, and then cases in the High Court. So that's your afternoon, or that's what you're getting from us for the next 40 minutes. There's a lot to cover, so we'll try and get through as quickly as possible. I always think the interactive session of talking and discussing is the most important. And thank you to the morning speakers. That was, I found, very interesting and insightful. So starting first with just general principles, principle of autonomy, basically that I can decide what I want to do with my body. It's as simple as that. You may think it's as simple as that, but when you're out there and you see cases, it is not, I'm afraid, as well recognized or respected perhaps as it should be. And of course equally applicable to pregnant women. And that's a very important statement, and one that we must all remember, and certainly healthcare professionals should keep in mind at all times.